Welcome back, everybody. We are talking today about ultra running and IBD. So I'm here with our very own Christa Smith, who is an IBD dietitian here at Crohns and Colitis Dietitians, and she also is a special sports dietitian. So she specializes in IBD athletes in particular. And we've gotten quite a few ultra marathoners and people doing a lot of endurance sport lately. So I thought we would dive into that as a topic. And, yesterday I polled Instagram and asked, what kind of ebook should we create? We've been on a roll with creating ebooks, and a lot of people voted on sports nutrition and IBD. So I thought we need to create more content around that. So I thought we'd talk about that. And I've also been surprised that not a lot of people know that you're here. Maybe it's because most of our videos it's like been Danielle and I. And now that Danielle's out for the month, we have had a little bit more videos. So people are like, who's Christa? Where did Danielle go? So
I'm excited to be here, and I'm excited to kind of show my face a little bit more. And Danielle's coming back, so don't worry, everyone.
Yeah, she is coming back. It's not forever. But yeah, it's definitely made me think, gosh, we need to do more videos with you so people know who you are, and we get to talk more about your interest, just kind of that intersection of IBD and sport, kind of this perfect scenario of both. And it's been so interesting to find out, they're talking about it, just how many IBD athletes there are out there. And by athletes, we mean people that are like professional level down to people that are, more just wanting to enhance their workout journey while also having IBD.
Yeah. And so many people, who doesn't want to be, more active? And then I hear that a lot from even patients who are, it's frustrating when either IBD, you feel like it gets in the way and you can't be as active as you want to be. And I have a lot of clients are coming and saying like, that's kind of a goal. I want to be able to manage things better so that I can be more active. And that's where we come in.
Yeah. And ultra running in particular, we've gotten a lot more questions about that this past week of people that are like, what's your experience with it? And you actually have a fair amount of experience in that area. So tell us a little bit about that. Like what's been your experience so far? And did you do your paper on that particular topic when you were becoming a sports dietitian?
Yeah, so whenever I was pursuing sport, this was, maybe 2021-ish. And as I was doing my diploma through the International Olympic Committee, we have to do, after the end of the culmination of the 2 years, you write a big paper. And I did my case study on an ultra endurance trail runner with Crohn's. So she was like the perfect case study. And I really did want to combine the two worlds and try to do that well. So I got to work with her during the whole time I was trying to formulate all of this paper. So really, really enlightening and eye-opening and challenging to kind of put these two worlds together. And then since then have had more experience in both of those worlds separately. And then after, as we're doing more work with Crohn's and Colitis Dietitians, obviously those worlds are coming together more and more often.
Yeah. What's your favorite thing about working with IBD athletes specifically? Because you came to me with this idea of in the very beginning, I want to do both. This is my interest. And it was interesting to me. So tell everybody a little bit about that interest and why you're so compelled to reach out to that group and to work with people that are doing that.
Yeah. It probably stems just from personal background mostly, and I have always been an athlete and have loved athletic arenas and scenarios and things. But I really do love clinical work and the clinical world. And then obviously us being IBD patients ourselves, those two worlds are naturally colliding for me. And so I find myself wanting to kind of research and understand. And I was talking to another dietitian because I'll sometimes work with other dietitians to kind of either help them with their patients or just kind of help, collaborate in a way. And I was just talking about how I love this intersection. And she was like, I'm glad you do, because it feels like a Rubik's Cube to me and I don't like it, And so I think there's part of just the challenge of it and figuring out what will work for an individual based on the evidence and what we know. And I think that's the fun for me. It's kind of like everybody's different and everybody's a challenge.
Yeah, I can see that in you. And One, I feel like anyone who wants to work with IBD patients, you're already a challenge seeker, right?
That's true. That's true.
Because for those of you that don't know, becoming an IBD dietitian is rare. There's not a lot of us. There really isn't. Like when we meet people that are IBD dietitians, we're always like, wow, like
Yeah.
let's get together and do a meeting. Because there's still a handful, and now it won't always be that way. Lots of people, including our company, the goal is to encourage more IBD dietitians because we're going to need more as the years go on. So people who choose this path definitely like a challenge, like to learn, because there's a lot of learning involved and it's always changing. That's definitely the case. But definitely the intersection, and I find sports nutrition to be it feels like a science. Like to me, working with athletes is quite different in terms of even just how they're oriented. They're oriented a little bit different. They don't want to talk it out as much. They kind of just want to like give me the number. They're go-getters and they want the specifics, and they're very goal oriented. So it is interesting to work with people in both of those realms.
Yeah. Very data driven usually. Yeah.
Yeah. The challenge plus being oriented in a way that they often don't talk as much about things. Yeah.
Maybe that's why I like it too, because I feel like I'm a very sequential, what's the word? I like
Practical,
systematic.
Yeah.
I like that kind of work.
Yeah, I feel like you and Del, both really like a system. We talked a lot about like flow charts, and don't we wish everyone operated like a flow chart? If not this, then go this route.
I know, and I have to see it. I have to put it all out on paper, and I feel like too, athletes kind of like to see the plan and to see where we're going, have a goal, and I work that way.
Yeah, it's important to have that. It's important to have systems, and have like this whole space for the fact that people don't always fall into the box either.
Right,
So,
right.
like you have to be you're very versatile in that way of like understanding the flow and the system, but also knowing when to get creative and when to think outside the box.
Yeah. Art and science together, right?
Yeah, it definitely is a little bit of both. So have you had I know you've had interesting cases, but maybe what's been your most interesting case of ultra running in IBD?
Yeah, I can think of definitely one specifically that kind of stands out. And she was just like the perfect case study, really, because she had Crohn's for like 10 years. She had, recently changed medications. There were some bone mineral density loss over the course of time, just with steroid use and things like that. There was some anemia that had gone on, both related to Crohn's and her high activity level. She was topping out at like, 50 to 65 miles, super active during the week, lots of climbing because lots of her terrain was, mountainous in her ultras, and it was kind of put more toward like the end of her weeks because she was still working full time. A couple days of weight training thrown in there, walking her dogs every day, tons of activity. And then we were also trying to balance, all of her inflammatory markers and vitamin D levels and all the things that come along with IBD with a significant health history. And she had tried all of these different diets, low FODMAP. She was mostly vegetarian, just struggling to kind of figure it out. She had restricted gluten and dairy in the past and kind of was still following some of that, but was just left in confusion. And so it was really fun to kind of get in there and figure out, okay, what's working and what's not, and where are the big pitfalls that we can make big impact if we kind of tweak things. So yeah, she kind of sticks out as a good case study.
Yeah. Where do you think things ended with her? Like, what was the biggest change?
Yeah, biggest changes with her were we made a huge impact on just her energy and stamina. We were dealing with a little bit of to me, she was really on the verge of injury, and we were trying to prevent that. We were trying to manage those inflammatory levels and, replete nutrients and on all the things, bring up calories because that wasn't quite high enough. We were trying to bring in more carbohydrates and more hydration during her training runs and during her competitions. And that's a challenge. But in doing all of those things slowly over time, we really did. She was like, I have so much more energy, like, especially the days after those long runs and training bouts, and just like more energy as she, like, during, like, throughout her day. So at the end of the day, she wasn't just like dog tired. And yeah, we really increased her tolerance to nutrition during her training, which was really imperative. And we were talking a lot about that. We need to do this so that we can protect your gut from any further damage. And so we did kind of a both. We increased nutrition, then we also kind of played around with her training. And so we brought down some of the intensity of some of the training bouts and gave her more rest days, because that was really important to me. Like, if we're going to train and compete at a high level, we have to treat our rest with just the same amount of respect and, like, oomph that we do our training.
Yeah, that's a hard thing to do for athletes, for sure.
Yeah, it is.
Harder than telling them let's increase the workout. I feel like is learning to rest as a means to better performance is a challenge.
Yeah, I agree. And I think it's kind of helpful to look at things on a timeline, or at least see it visually somehow, because I plotted out what she was typically doing. So very typical, like, work day type of eating, like maybe grab a granola bar and some coffee in the morning, not really have a snack. Maybe on some days she'd do a mid-morning training, and then after that she wouldn't have anything until lunch. It might be like a Buddha bowl type thing. She might have a quick snack in the afternoon. She might have maybe a banana or another granola bar or something, and then go into afternoon training straight to dinner. And then, kind of start that all over again without much strategy in her nutrition. And so that was a really big part of us working together, is kind of figuring that out and being able to create a plan that really, utilize more strategy for her training.
Yeah. Yeah. It's interesting. I definitely feel like I've seen that at all levels too of athletes, is that even at professional levels, just the undernourishment is something you see so often, even in people who do it for a job.
Yeah.
And even people that can hire their own full-time dietitian, those people are still often undernourished. I think an outsider might just assume that they have it all together,
Yeah.
even at this high levels, but generally they don't. And I think especially in the case of IBD athletes, we have this increased risk of being malnourished in general.
Yeah.
And it can very much impact your energy and your recovery and your gut. We don't often think about the gut effects.
Yeah, and it's kind of counterintuitive a lot of the time. And I lost my train of thought, but that's where I was going with that, where I was saying that we plotted out what we were doing, but to show her the imbalance of the two. And I was like,
Wow.
if this is where your training is, and really ideally, your body doesn't start over at 24 hours, like a clock. Okay, here's your calories for that 24 hours, and it starts. So it doesn't do that. It's in tandem all the time.
Mm-hmm.
And I was like, if we're trying to create and have the energy that you need to go into a morning training or an afternoon or an evening or weekend or whatever, we need to have this within day balance, and I'm like, look, you can see here, if I calculate your METs for this training, so that's just how many calories are required for whatever level of whatever you're doing, and you've only had a granola bar and black coffee. And then, maybe we had this big swing, maybe a bigger lunch or whatever. And then maybe you go into another training bout, or you also tack on walking the dogs for another hour. And look at these big energy dips, and we're not providing your body with enough support. And that can be really helpful for athletes to be like, oh, okay, I can see what you're talking about.
Mm-hmm. Yeah. And so you're talking about energy deficits and just meeting your basic needs. Now there are calculators online and stuff where people can sort of plug in and make some guesses, right? But where do you feel like those calculators go wrong in terms of like the IBD athlete, and in terms of like have you seen that a lot where people are like, well, I know what I need. Yeah, I'm already getting it. I used the calculator.
Yeah, and I mean, good grief, even without IBD, you still have to think
Yeah.
about them with a grain of salt. Like it's a calculator. Like it's not it's not you. It's very evidence-based, and like they're using good data, but it's still you are the sample size as far as like what's going to work for you. And then if you tack on an inflammatory disease state, depending on where those inflammatory markers are, like our needs are going to be higher usually. And we don't know all of those. The calculator can't know all of these other factors. And even us, it's usually a bit of it's a back and forth. We're having to see what works, what needs to be tweaked. So it may be a good starting point, but it certainly there's nuance there that needs to be applied. And that's, you're not going to get that from an online calculator.
Yeah, I think that's where a lot of DIY can go wrong. And you can often think that you can feel like, oh, I'm doing it all. But if you're still feeling low energy and you're noticing more gut symptoms and your performance is lacking and you're having all of those signs, I think that's really a good moment to check in with yourself and see if you could maybe benefit from, working with a dietitian or someone specialized in that particular area, to where you can dial that in a little bit further. Yeah. So if you do feel like you're kind of in that spot where something's not working, I would say reach out, and Christa's still taking patients too, if you're kind of in that intersection of, needing some sports dietitian component, but also maybe needing IBD specific guidance, please reach out and let us know. And we're happy to chat with you and help you, point you in the right direction for next steps.
Absolutely.
All right, well, this has been a great conversation, and I hope this was helpful for everybody to kind of understand a little bit of the ultra running side and our thought process on everything as we work with patients in that realm. So thanks for coming on again, Christa, and until next time, take care, everybody.
Thanks.